Gaurav. We are, thank you. So we are a dental hygiene school coming from the Canadian Academy of Dental Health and Community Science. This college in Mississauga here on Ontario. Today we are going to talk about like oral hygiene practices. Like different backgrounds, they have their culture about like using brush, like the remedies if they have any pain in their teeth. Different culture have different remedies, okay? So next slide, I'm gonna show you what we are gonna talk in this presentation. So we're gonna mention the clove. How many of you know the clove? Fantastic. Miswak. Miswak. Or neem. Fantastic. And the salt. Everybody uses the salt, I believe, right? And how many of you heard about the charcoal? Charcoal. Yes? Good. And cooling oil. So probably most of you familiar with these products. We're going to talk about their benefit today and the risk of using them. Okay? Next slide.
What is miswak?
So we're going to talk about every product in different slides. We're going to show you how you can, how it's look and what the benefit and the risk of it. But for now, we're going to talk about these products. So as I told you, we are here to talk about these products. Now I'm going to put the next slide, please. So everybody have their own routine, right? Some of you maybe brush 1 time a day. Others brush 2 times a day. Maybe some of you floss once a day, 3 times a week. Like everybody has different routine. Maybe you will learn it from your grandmother, from parents, from the friends of the friends, right? So in the other slide, I'm gonna ask you questions. And you can put the other slide, please. And you can like just say no or yes or raise your hand. Whenever I say the question, you just like raise your hand so I can see how many of you do this. So, do you brush your teeth twice a day? Nice. And do you learn oral care from your parents or grandparents? Nice. Do you still follow these habits today? Yes. So what we learned when we were kids, it stayed the whole life. Have you ever used a home remedy for oral care?
Yes, yes.
Okay. If you have tooth pain, do you try home remedies first or you go to the dental office? Home care. All of us. Have you heard of a natural method for cleaning teeth?
No.
We're going to talk about it. Do you think these methods are safe?
Yes.
Do you feel comfortable sharing your habits with dental hygienists? No, right? Do you think oral care differs across culture?
Yes.
It's different, like from country to country, right? Okay. Last question. Have you ever been advised to use traditional remedy instead of visiting a dentist?
Yes.
Yes and no. Okay. So now I'm going to pass it to my colleagues so they can explain those remedies one by one, okay? And if you have any question, please feel free. Just raise your hands. We have Gaurav and Nihar. They can translate for you if you have any question, okay?
Hi everyone, my name is Jewel. So I'll be talking about clove and clove oil as a one more product that I'm going to be talking about. Okay, so audible now? Okay. So many of you must be familiar with clove. You see that in your house every day. Have you used it many times when you have tooth pain? Yes, it's very common, right, in a house. So you know that clove comes from a white flower from the clove plant, okay? So the clove has something called as eugenol. So that is what helps reduce pain. So when you have toothache, you put the clove inside the teeth. So it has something called as eugenol. That is what helps with the pain. Okay, that product is what helps with the pain when you put clove inside the teeth. So there are many cultures. Like I'm from Kerala, south of India. So we use clove a lot. So many of you must be using clove. So every culture has a different way of using the clove and clove oil. And let's move on to the next slide. Okay, I'm just going to run about the uses of clove and clove oil in maintaining your oral hygiene, like how to use it inside the mouth. So it is used topically, meaning you just place it on top. You never use it like deep inside, you just use it on top, just to rub, okay? And you never use it like a mouth rinse, not to swish your mouth, gargle, no. It is just placed on top. So a few drops of clove oil, you have a clean cotton swab, you keep 1 drop of clove oil and then you can put that there. So the cotton is gently placed on the painful tooth or the gum area. If you feel it is very strong, you should dilute it in some other oil. Because clove oil has very strong smell and the taste is also very strong. So if you feel it's very strong, dilute it. Some people, they place the whole clove inside the teeth. We see that very often. The small ball kind of thing, we keep it inside the teeth, it's very common. So yes, you get temporary relief when you put clove inside the teeth for some time only. Not 100%, but for some time you can get some relief. So in dentistry also, we have some temporary filling materials. That also has this thing which I told before, eugenol. So even we use a little bit of eugenol when we put cements inside your teeth. Moving on to the next slide. Okay, advantages, like I told before, like the benefits. It will help reduce the pain from tooth pain, first thing. It has antibacterial effect, meaning it can kill a little bit of bacteria in the teeth. It can reduce inflammation, like if you have big swelling, it is helpful in reducing the swelling also a little bit. It is easily available, everybody will have clove in your house, so it's ready-made, it's easily available to use every time. And many of us use it in most of our cultures, right? Okay, moving on to the next slide. It has a lot of advantages, but still, it has some disadvantages. Most of us might not agree, but then these are from research. So I just want you to keep this in your head. It has advantages, but it also has some disadvantages. First thing, the taste. It's very, very strong. Agree? Yes, the taste is very strong for most of the clove oil. Second thing, if you use a lot, it can cause some burning or irritation inside your teeth or the gums, especially the gums. Yes. So too much will damage the tissues, like the gums are very soft. So if you put a strong amount of clove oil, it can burn the gums because the gum is very soft tissue. So anything a little bit more can harm the soft tissues. Again, like I told before, these are all temporary pain relief measures, not permanent. If you put clove oil, it can reduce the pain for like 1 or 2 hours, but never a permanent solution for toothache. And some people, they can have allergy to clove oil. We might not know, but some people can have allergy to clove oil. Moving on to the next slide. So this is a short video. Just see that and let's come back.
What happens when you have cloves regularly? Eugenol in cloves works as an anti-inflammatory agent, anesthetic, and has antibacterial properties. It improves oral hygiene, reduces gum inflammation and tooth pain, helps with bad breath, and combats several types of bacteria.
Okay, this video just tells about whatever I told before, like it has many advantages like helping reducing pain, but too much is also not good. Okay, moving on to the next product, charcoal powder. Has anybody used this before? Charcoal powder? Yes, even I have used that when I was a kid. We mix a little bit of charcoal powder and salt and then we rub it with our hands or we use a toothbrush. Yeah, so most of us must have used that in our cultures. Okay, so you know from where you get charcoal? From the burnt wood. We use it to clean the teeth. We feel that it makes the teeth very bright and shiny. So today, because we don't use the normal methods of getting the charcoal, mixing it with salt, so we have it readily available in the charcoal toothpaste. Like Colgate has the charcoal toothpaste, so it's readily available there. Next slide, please. Okay, why do we use charcoal? It is used to clean the teeth and remove the stains. Okay, very good for cleaning, and then the stains can also go away a little bit. And some people use it to make the teeth even more white. And also it comes in powder form or toothpaste form. Like the Colgate has a charcoal version of it, like that. Next slide. Okay, moving on to the benefits and the disadvantages. So it can remove surface stains, like it makes the teeth a little bit whiter. That is true. It is natural, it is readily available. You don't have to pay any expenses for that, for buying charcoal. So that is also easily available. And temporarily your teeth can look white and clean when you use charcoal. But always using charcoal is not good for the teeth. Let me tell you why. So when you use charcoal, the powder is not very soft. It has some abrasives. So too much of charcoal will take away the enamel in your teeth. So when this enamel in your teeth goes away, what will happen? Your teeth will become sensitive. Nobody wants sensitivity, nobody likes sensitivity. Sensitivity means if you drink hot, cold, you can't, you will be like, you can't. So too much of charcoal powder will make your teeth become sensitive because the enamel will go away. Another thing is most of the toothpaste that you use now has something called as fluoride. Fluoride is a very important material inside the toothpaste because it will prevent cavities. So if you use charcoal, you don't have fluoride. So who's going to protect your teeth from cavities, right? And then long-term safety is not supported by the research that is conducted nowadays. So nobody says that using charcoal for long-term is like very good for your teeth. Okay, moving on to the next slide. So just to summarize, just my key tips before I pass it on to the next mentor. So clove oil, it will help reduce tooth pain temporarily, but the dental problems do not go away when you use charcoal, clove oil or the cloves. So clove oil should be only used as a temporary home remedy until you get to the dentist. Until you go to the dentist, you can just use it temporarily. Never say that, okay, I used clove and I'm done, my problem is solved. No, you need to go to the dentist, make sure your problem is attended.
But how much time, dear? Okay, how much time we have to keep it with clove oil?
I would say like 1 to 2 hours until you can go to the dentist. It's all temporary.
I was using it there, being very bad, because my lip was giving the problem.
Okay.
It was going to be swollen, so I had to keep, my doctor told me to use clove oil.
Yes. Just for the time being is okay. Till you can go to the dentist. Like today you have pain, but your appointment is tomorrow. Yes, you can keep it until today. Okay, and charcoal products, it will help remove some stains on the teeth, but it can wear down the enamel and it will cause sensitivity on the teeth, which we don't want. And always use a toothpaste which contains fluoride because it will help reduce any cavities in the future. And if you are using any home remedies continuously, always when you go to the dentist or the hygienist for teeth cleaning, tell them that I am using this, is that okay? Or if there's any suggestions, just be open to them, just tell them that you are using these products, is that okay or not? So that might help you in including all your cultural products also in taking care of your teeth. Thank you so much, I'll pass it on to my friend now.
Thank you.
Hello, good afternoon. You guys are okay with English because I do understand Urdu, so you want me to switch over to Urdu if it's okay?
I think that will be much better.
Yeah. So, खुश आमदीद आप सबको. आप लोगों को अभी तक जो चीज़ें मेरी फ्रेंड्स ने शेयर की हैं about dental teeth, जो हमारे problems होते हैं और जो culturally, traditionally हम अपने मुल्कों से सीख के आए हैं, तो आप लोगों में से कितने लोगों को मिसवाक के बारे में पता है या आपने सुना है? ठीक, that's nice. या आपने कभी यूज़ किया है मिसवाक? Okay, yeah. तो मिसवाक नॉर्मली कुछ कल्चर्स में, स्पेसिफिकली कुछ रिलीजियस जैसे मुस्लिम्स में बहुत कॉमनली इसको यूज़ किया जाता है दांत की सफाई के लिए एज अ ब्रश. लेकिन मिसवाक बना किस चीज़ से? दरख्त एक है सार्गलीना के नाम से, तो उस दरख्त का पार्ट होता है, उससे वो काट काट के उसकी शाखें बनाते हैं और वो بہت سالوں پرانی بہت سالوں سے لوگ استعمال کرتے آ رہے ہیں مسواک کو دانت کی صفائی کے لیے. سو you guys are getting so if you guys have any questions we will ask. ہم آخر میں بالکل اینڈ میں جب ساری پریزنٹیشن ختم ہو جائے گی ہم سب سے آپ سے کویشچنس لیں گے. تو مسواک کے بارے میں یہ ہے کہ ایک جڑی بوٹی ہے, درخت سے لیا ہوا ہے, کاٹ کے اس کو بنایا جاتا ہے اور اس سے لوگ دانت کی صفائی کرتے ہیں, برش نہیں کرتے ہیں. اب اس کے کچھ فائدے بھی ہیں اور کچھ نقصان بھی ہیں. جیسے اس کے جیسے برش کے جو برسٹلز ہوتے ہیں آپ کے وہ بہت سافٹ ہوتے ہیں, لیکن مسواک کافی سخت ہوتا ہے, تو وہ دانتوں پہ اس کے لگانے سے آپ کا دانت جھڑ بھی سکتا ہے. تو ان دا نیکسٹ سلائڈ I will discuss this. تو آپ نے دیکھا ہوگا مارکیٹ میں بہت ایزیلی اویلیبل ہے مسواک پروڈکٹ کے نام کے بہت سارے ٹوتھ پیسٹ, اور وہ اس کی ایکسٹریکٹس نکال کے ٹوتھ پیسٹ میں ڈال کے اس کو بیچتے ہیں اور جسٹ ٹو پروموٹ. اب وہی بات ہے کہ اس کے نہ بہت زیادہ نقصان ہے نہ بہت زیادہ فوائد ہیں. اگر آپ اس کو صحیح طریقے سے استعمال کریں تو اس کے فائدے بہت ہیں. جیسے کہ یہ بیکٹیریا منہ میں ہمارے 2 طرح کے بیکٹیریا ہوتے ہیں, ایک گڈ بیکٹیریا ایک بیڈ بیکٹیریا. تو یہ جو بیڈ بیکٹیریا ہے اس کو یہ کم کرتا ہے, آپ کے منہ میں بننے نہیں دیتا. مسواک کا یہ فائدہ ہے. دوسرا فائدہ یہ ہے کہ آپ کا جو منہ کا جو جیسے ہم بہت دیر تک اگر پانی نہ پئیں یا ہم چائے کافی وغیرہ پیتے ہیں تو ہمارے منہ میں ایسیڈیٹی ہو جاتی ہے یا تیزابیت فیل ہوتی ہے, تو یہ مسواک سے تھوڑا کم ہو جاتا ہے. آپ کا منہ کا جو انوائرمنٹ ہے وہ نیوٹرل رہتا ہے جیسے پانی کی طرح. دوسرا یہ کہ اس میں نیچرلی کچھ کنٹینٹ ہوتا ہے, یہ سائنٹیفکلی پروون ہے کہ اس میں کچھ کانٹینٹ ہوتا ہے فلورائڈ کا, جو کہ آپ کے دانتوں کے لیے بہت ضروری ہے. ہم برش کرتے ہیں تو دانت کے ساتھ کچھ پیسز جھڑتے ہیں تو یہ ریمنرلائز کر دیتا ہے آپ کے ٹوتھ اسٹرکچر کو. نیکسٹ سلائڈ. سو ایز یو کین سی کہ یہ اس کے بالکل جھاڑ نما ہوتا ہے اور آگے سے اس کے اینڈ کٹا ہوتا ہے, جیسے سے اس کو آپ لوگ بتا رہے ہیں کہ آپ لوگوں نے نہیں یوز کیا, لیکن اس کے بہت زیادہ ریلیجس کچھ کلچرز میں یوز ہوتا ہے بہت فریکوینٹلی. اوکے اینڈ دا نیکسٹ سلائڈ. سو جیسے میں نے پہلے بتایا کہ اگر آپ اس کا صحیح استعمال نہیں کریں گے تو آپ کے مسوڑے کافی نیچے چلے جاتے ہیں, خون آنے لگتا ہے. ہر چیز کا ایک بیلنس ضروری ہے, نہ آپ اس کو کمپلیٹلی اس پہ ریلائی کریں نہ کمپلیٹ, مطلب کچھ اس کے فائدے ہیں تو آپ ماڈریٹ طریقے سے مسواک کو یوز کر سکتے ہیں, رائٹ. اور اس طرح آپ نے دیکھا ہوگا دیسی اسٹورز پہ یا لوکلی اسٹکس کے فارم میں یہ اویلیبل ہے. اوکے اب یہ والا ہم نیکسٹ موو آن کریں گے ٹو دا یوز آف نیم. آپ لوگوں نے نیم کے بارے میں سنا ہے اور یوز کیا ہے, رائٹ. اور ہم نے شروع سے یہ سنا ہے کہ نیم کے بہت فائدے ہیں, صرف فائدے ہی فائدے, کوئی نقصان نہیں ہے, رائٹ. ڈیفینیٹلی اس کے فائدے ہیں کیونکہ نیچرلی اینٹی آکسیڈنٹ ہے آپ کے بلڈ میں, آپ کی باڈی کے اندر, آپ کے منہ کے اندر جو بھی بیڈ بیکٹیریا ہیں ان کو یہ کم کرتا ہے, ختم کرتا ہے, اور اس کے بہت فائدے ہیں. لیکن آف کورس اس کو بھی بہت ہمیں طریقے سے استعمال کرنا چاہیے. بہت سارے لوگ اس کا اس کو پیسٹ بنا کے دانت پہ لگاتے ہیں, رائٹ. تو اس سے یہ ہو سکتا ہے, فائدہ یہ ہے کہ بلیڈنگ آپ کی گم انفلیمیشن, جیسے مسوڑے سوج جاتے ہیں, خون آتا ہے, تو اس میں یہ ہیلپ کرتا ہے, کم کرتا ہے نیم کا استعمال. لیکن کچھ ابھی میں نیکسٹ سلائڈ میں آپ کو یہ بتا سکتی ہوں کہ نیکسٹ سلائڈ. سو ایز یو کین سی آئی جسٹ روٹ ڈاؤن کہ آپ کے اگر مسوڑے میں تکلیف ہے یا سوجن ہوئی بھی ہے تو اس کو نیم کے استعمال سے کافی کمی آئے گی. لیکن اگین وہ آپ کو کمپلیٹ پین ریلیف نہیں دے گا, اس کے لیے آپ کو روٹ کاز کو کیٹر کرنا پڑتا ہے کہ ایگزیکٹلی پین کس وجہ سے ہو رہا ہے. تو اگر آپ اس کو مس یوز یعنی کہ اگر بہت زیادہ استعمال کریں گے تو کبھی کبھار آپ کا ٹوتھ اسٹرکچر بہت اریٹیٹ ہو سکتا ہے. آپ کا جو مسوڑے ہیں وہ بہت سینسٹیو ہیں. جیسے ہم چائے پیتے ہیں, ہماری زبان زیادہ گرم چائے ہو تو بہت تیز وہ جل جاتی ہے, تو ہم یہی ریکمینڈ کرتے ہیں کہ نہ بہت کھولتی ہوئی چائے پئیں یا کافی, اور نہ بہت مطلب ماڈریٹ ٹیمپریچر ہو, کیونکہ ہمارے جو منہ کے اندر کا میوکوزا ہے وہ بہت ڈیلیکیٹ ہے, بہت سینسٹیو ہے. تو اس طرح کی ہارش چیزیں جو ہے نا دانت کو اور منہ کے اسٹرکچر کو بہت ہارش لگتی ہیں. سو نیکسٹ سلائڈ. सो इधर वही मैंने आपको जैसे बताया कि हर चीज़ के फ़ायदे और नुकसान दोनों हैं, आपको बहुत तरीके से इस्तेमाल करना है क्योंकि इसमें पोटेंशियल है। नीम में बच्चों में तो बिल्कुल इट्स लाइक जहर की तरह का होता है कि मतलब टॉक्सिक होता है किसी, तो बहुत हम इसको तरीके से इस्तेमाल करना है। और हम लोगों में या हम लोगों की हमसे जो बड़े लोग हैं उनके लिए भी उनको बहुत इस तरीके से बहुत डेलिकेटली इसको हैंडल करना है। सो ये मेरी तरफ से था। इंशाल्लाह अगर आप लोगों को कोई भी सवाल होगा तो हम एंड में आप पूछ सकते हैं, ठीक है? I'll pass it on to my friend now, everyone. Yeah, thank you.
Hello everyone. So I'll be talking about salt and oil pulling methods. So how many of you guys have used salt? Right? Okay, so I have used it when I was a kid. Salt mixed with charcoal to brush my teeth. Okay, so salt is a natural mineral which is commonly used in oral care, right? Salt as such, and salt is also available in paste like Colgate paste and a lot of material, right? And it has a cleansing and mild antibacterial properties as such as of neem. And also it is used in traditional and home-based remedy, right? It is often combined with water for rinsing purposes. So once you have extracted your teeth, your dentist might say that you will have to rinse your mouth with a salt water gargle, right? So yes, salt can be used in water rinsers, and also it can be used mixed with charcoal to brush the teeth. Next slide. So I'll be talking about uses of salt in oral hygiene. So it helps to reduce the gum inflammation. Inflammation is like the swelling of the gums, and also it helps in healing of oral wounds and ulcers. Okay, so I recently had an ulcer and I have placed salt and it has reduced in 2 days, right? So how many of you have used that with salt? Okay. So it also helps to control the bacteria which is in our mouth, and it provides relief from toothache and sore gums, right? It helps to reduce in swelling of your teeth.
And how many times you have to use it?
The salt, I would say you have to use it really less, because I'm coming to the disadvantage of using the salt more often, okay? So it also supports overall oral cleanliness. So now I'll be talking about the disadvantages as well. Next slide. So advantages is it is easily available and it is of low cost, right? It is easily available in supermarkets. It is used in food, right, as well. And then it is natural and it is generally safe, and it is simple to use in our daily oral use. And it has minimal side effects when it is used properly. Next slide, please. So disadvantages. So it can be abrasive, right? Salt is not soft, right? When you try to brush your teeth with salt over a long period of time, you can lose your enamel of the teeth, and then it can become more sensitive. So when you're drinking hot and cold, you can feel the pain, right? Over a period of time, when you use salt, it can lead to abrasion. And then it can also irritate your oral tissues, which means salt, when you use it in your mouth, it causes dehydration to your oral tissues, which is also not really good. And then it do not replace brushing and flossing as well. So brushing your teeth is very effective than brushing with salt and charcoal, because over a period of time, it can definitely lead to sensitivity. Next slide. So oil pulling, how many of you have done that? Oil pulling, have you heard about it? Yeah. Oil pulling. So yes, oil pulling is using of oil to squish in your mouth for 10 to 20 minutes. Have you used? Okay, good. So most of the common oil that we use is coconut oil and sesame oil. What kind of oil have you used? Coconut oil? Yeah, coconut oil is the most common one. So it is a traditional practice from Ayurveda, and it is used as a natural oral cleansing method. Next slide. So the uses of oil pulling in oral hygiene is that it is a traditional oral cleansing practice. So it provides temporary breath, breath freshening before social interactions, and it also supports the routine for dry mouth comfort, right? If you have dry mouth, as we become older, our mouth will be drier, right? So it'll be helpful for that as well. And then complementary practice can be used alongside with blushing and flossing. So the advantages of oil pulling are it helps to reduce the plaque accumulation and also improves gingival health. So it says it helps to reduce the inflammation of your gums and also reduces your bad breath, right? Before the social interaction or before talking to anyone, you can use it. And then it acts as an adjunct to daily oral care. The disadvantages is that it is time consuming, right? So we use oil pulling method at least 10 to 20 minutes and then it has very limited, there is no proven scientific evidence of using oil pulling, and it is definitely not a substitute for brushing and flossing and other oral hygiene methods. And there are risk of nausea, which means you will have a feeling of vomiting after using it, and also improper use can lead to aspiration as well. Next slide. I'll pass it on to
become very much sensitive.
after using the oil pulling. Oh, okay.
Actually clean your teeth. Let's find out for you. So backward. Now let's switch up. Gee, imagine that. My teeth are still dirty. Looks like chewing gum white.
Now I'll pass it on to Gaurav for the conclusion.
नमस्कार सभी को, मेरा नाम गौरव नागर है और अभी मैं आखिरी सेमेस्टर में CADH में पढ़ रहा हूँ। तो अभी हम सबसे पहले एक वीडियो देखते हैं यहाँ पे।
When and by whom was toothpaste invented? Ancient origins. The earliest known dental cleaning agents date back to ancient Egypt, around 3000 to 5000 BC. Egyptians used a mixture of powdered ox hooves, ashes, burnt eggshells, and pumice to clean their teeth. Similarly, ancient Greeks and Romans used abrasive substances like crushed bones and oyster shells, combined with flavorings like charcoal and bark. Medieval and Renaissance periods. During these times, different cultures continued to develop their versions of tooth cleaning pastes. In China and India, tooth powders made from various herbs, salts, and other ingredients were popular. 19th century, the modern concept of toothpaste began to take shape in the early 19th century. In the 1820s, a dentist named Dr. Peabody suggested adding soap to tooth powders. Around the same time, a dentist named Dr. John Harris added chalk. 1873, the first commercially produced toothpaste was launched by Colgate, initially in a jar. Colgate and Company began mass-producing toothpaste in the United States, marking a significant milestone in dental hygiene product.
तो जैसा कि हमने देखा कि 1873 से पहले कोई भी टूथपेस्ट एज पर कमर्शियली यूज़ नहीं होता था, तो 1873 के बाद ही हुआ है। जैसा मेरे फ्रेंड्स ने भी अभी बात किया है, उससे पहले जो भी लोग यूज़ करते थे अपने दांतों की सफाई रखने के लिए, वो बेसिकली ऑयल पुलिंग, क्लोव अगर कभी किसी को दर्द होता है तो, या फिर बेसिकली नीम की कीकर की या फिर मिसवाक की दातुन का इस्तेमाल करते थे। तो नेक्स्ट स्लाइड प्लीज। तो जैसे कि अलग अलग कल्चर्स में प्रैक्टिसेस होती हैं, जैसे कि ऑयल पुलिंग की है, कोकोनट का ऑयल मतलब स्क्विश करते हैं, कुछ लोग रब भी करते हैं, कुछ लोग इसे सॉल्ट के साथ मिलाते भी हैं, सरसों के तेल को सॉल्ट को मिला के बहुत से लोगों ने पता होगा कि वो साफ रखते हैं। अगर किसी को दर्द होता है तो तब भी वो यूज़ करेंगे। उसके अलावा नीम की दातुन, चारकोल का इस्तेमाल, ये सब बहुत नॉर्मल है, इवन आज भी बहुत सारे लोग यूज़ कर रहे हैं। 1873 के बाद से जो टूथपेस्ट है वो काफ़ी रेगुलर हो गया है। समवेयर स्टार्टिंग ऑफ द 1900 ड्यूरिंग द फर्स्ट वर्ल्ड वॉर गवर्नमेंट ने इस पे काफ़ी सारा टैक्स हटा दिया था ताकि ये सैनिकों के लिए इस्तेमाल हो सके, इजी टू, ताकि वो अपने ओरल केयर रख सके। बेसिकली जितने भी ये प्रोडक्ट्स हैं